Hello and welcome to Pregnancy Info. Today we will discuss that when to perform pregnancy test for accurate results. Ovulation generally occurs around day 15 of a 28-day cycle. In a normal pregnancy, an egg is fertilized in the fallopian tube and then travels into the uterus, where it implants in the uterine wall. After implantation, production of HCG starts from cells in the developing placenta. Trace levels of HCG can be detected as early as 8 days after ovulation. That means you could get positive result several days before you expect your periods to start. However, the first part of your cycle is more variable than the second. When to take a home pregnancy test. The length of time from the first day of a period to ovulation can vary by several days from month to month. Sexual activity around ovulation leads to the possibility of fertilization of a released egg by sperm, but even then the time frame of a fertilized egg to implant can vary, and HCG isn't produced until after implantation has occurred. For more accurate results, we recommend testing in the morning on the day you expect your periods to start. This allows for variability in the timing of ovulation, fertilization, and implantation. Testing in the morning provides a more concentrated urine sample. How to use a home pregnancy test? Buy your pregnancy test from a trusted seller and check that the expiry date has not passed. Read carefully the instructions. You can do a urine test at any time of the day because HCG production doesn't change throughout the day. If you drink large quantities of water or other fluids during the day, you might want to do the test first time in the morning, as the accuracy of the test can be affected if the urine sample is extremely diluted. Whether your home test is positive or negative, it's wise to confirm the result with the healthcare provider if you can. Home tests are not as sensitive as those done in healthcare provider's office, and there is also more chances of human error. Sometimes you will get false negative test result. When a test result is inaccurate, it's either a false negative or a false positive. Several factors can cause false negative test result. Having urine that is too much diluted after drinking a lot of water or fluids, or testing later in the day. Testing too soon when there has not been enough time for a fertilized egg to plant and start HCG production. Using a pregnancy test that doesn't detect low level of HCG, you can check the package insert for more information about the level at which the test will be positive. If the test is false positive, yes, but this is rare. A positive result can also be caused by a pregnancy loss very soon after implantation, which can also be called chemical pregnancy. HCG secretion from a tumor. Pituitary HCG secretion typically in people going through perimenopause. Interference from HCG administrator as a part of infertility treatment. If you have had an injection of HCG, this should be cleared from your system after 2 weeks. Medications do not cause false positive pregnancy tests unless the medications contains HCG or rarely certain antibodies. Doing a pregnancy test can be emotional, whatever the results. Remember that you are not alone in this. Try to talk with someone you trust and ask for their support. If you are not sure where to turn, you can get confidential counseling in most healthcare providers' offices and clinics. Want to see a doctor? Most women who have a positive pregnancy test should wait a week or so before calling the OB/GYN office for a pregnancy blood test or ultrasound to confirm the pregnancy. We suggest waiting because the rate of early pregnancy loss is high, and it's possible that you might have had a chemical pregnancy. Women with a history of ectopic pregnancy or current abdominal pain should call the doctor right away to be examined. Ectopic pregnancies implants outside of the uterus and provide HCG, resulting in positive pregnancy tests. However, these pregnancies can cause abdominal bleeding and prompt medical care is necessary. Women who have congenital heart defects or other chronic physical or mental health conditions should also see a doctor right away because treatment plans or medications might need to be altered to protect the women and the fetus. So this is all about how and when to do the pregnancy test when you are expecting. Thank you and take care.